Welcome to Texas A&M AgriLife Extension, Hidalgo County. My name is Joanne, and I'm one of the Family and Community Health Connectivity Agents for Texas A&M AgriLife Extension, Hidalgo County. Today, we are going to be doing a walk and talk. What a walk and talk is that I will be presenting an educational presentation, which today's presentation will be Take Action, Be Med Smart, on how to properly utilize your medication, how to store them, and so forth. In the meantime, while I am presenting, the presenter will be walking. You can walk, you can jog. Alright, let's get started. Let's hear a story about Betty. I was a zombie. For my husband, my family, I was non-existent, says Betty, a 60-year-old retired bookkeeper, describing her nearly 20 years of prescription drug abuse. After a series of back surgeries, her physician kept prescribing her an increased potent mix of narcotic painkillers. Betty recalls those foggy years. The doctors were quickly to medicate when I complained of chronic pain. I never thought this would lead me to become an addict. As Betty's tolerance to her pain medication increased, so did her prescribed dosage and her level of pain. The consequences of Betty's addiction eventually caught up with her. It was a vicious cycle of seeking relief and getting stronger narcotics. Betty's life eventually spiraled out of control. She fell into a pattern of withdrawals from family, friends, sleeping all day and barely able to function because of low energy. Despite these signs of drug dependence, she didn't realize the extent of her problem until she forgot to apply a fentanyl patch, which is a narcotic that is about 100 times stronger than morphine. A short while after missing my dose, I became shaky, feverish, fatigued, and nauseous after missing my dose. I knew then I had a problem with taking so many prescription drugs. It was scary to realize that the medication she took to treat her back problems would cause a much bigger problem, addiction. After experiencing these withdrawals, Betty took immediate action. She consulted with her doctor, who changed her medication regimen and referred her to a specialist who was able to recommend a non-drug pain management therapy. She also began a recovery treatment for addiction. I remember being asked to bring my medicine to my therapy session and arriving with a shopping bag full of transdermal fentanyl patches, bottles of hydrochlone, a powerful opiate, and Xanax, an addictive sedative. My therapist was surprised that I was prescribed all those drugs. Looking back, she realized how lucky she is to have survived from her years of addiction. Fortunately, Betty listened to her body, paid attention to the warning signs, and questioned her doctor about her medication. After the initial weaning from prescription painkillers, Betty said she never felt better. I'm like a new person. My pain is under control, even less than all those years taking prescription drugs, she says. Betty's advice is to be an advocate for your health. She warns that addiction can happen to anyone when you don't take medicine responsibility. The medication generation is a good description of the U.S. aging population. Drug misuse and abuse is a concern for seniors because taking multiple medications is typical for this age group. Unfortunately, many seniors are not aware that many prescription drugs such as opiates or pain medication can become addictive. Betty's story is a warning to everyone, young and old, about addictive power and medicine, particularly pain drugs. How many take at least one medication a day? As we discussed, taking multiple medication is typical for older adults. Taking many medicine a day can be difficult for keeping up with a medication schedule and taking the right dosage. However, whether you are taking one drug or several, it's important to practice medicine safety. This talk will discuss ways to lower your risk for drug misuse or abuse. There are 3 types of medicine. One is prescribed by your doctor, non-prescription, and over-the-counter, which we will refer to as OTC, and dietary supplements. Prescription drugs are ordered by a licensed health care professional. Blood pressure medicines or antibiotics are examples of prescription medicine. Medicine can be purchased at a pharmacy, retail such as your local Walmart, Target, or you can even mail order or as well as the internet. Buying medication online may be risky and even dangerous. Over-the-counter drugs, which are non-prescription drugs, is found in drugstores, supermarkets, and discount stores. With the OTC drugs, you are in charge of picking the right medicine, taking the right dose at the right time, watching for side effects, and reporting problems if they happen. You need to be careful about over-the-counter drug interaction with other medication. Dietary supplements are herbal medicines that do not follow the same government rules that prescription drugs follow. The U.S. Food and Drug Administration, which is the FDA, approved and regulates prescription medicine. For this talk, we will focus more on the prescription and over-the-counter medication. Aging affects the body's ability to handle medicines. Adults 65 and over experience decreased blood circulations, and in turn, their liver functions is reduced. The slowdown of bodily symptoms increase the time that the prescription medication or over-the-counter remains present and active in the bloodstream. And medication dosage needs to account for the lengthening amount of time it will take older adults to metabolize and process the drug. Oral medications are times released through the body during a series of bodily processes. First, digesting the medication in the stomach allows the medicine to be taken up to the bloodstream. Once in the bloodstream, the medication is processed by the liver and continuously broken down into smaller compounds until it reaches its target action, such as relieving a headache. Standard labeling of over-the-counter and prescription medication may not accurately represent how long a drug will stay active in an older adult. Baby boomers of those born after World War II who are over 65 years of age are growing in number. By 2030, when the last baby boomer turns 65, 1 in every 5 Americans, about 72 million, will be an older adult. It is estimated that by 2050, there will be 89 million adults over 65. Adults over 65 of age are one of the largest consumers of medication. While they're currently making up 13% of our U.S. population, they account for 40% of over-the-counter drugs used and 34% of the prescription medications are used. Healthcare spreading in the United States will continue to rise as our aging society increases. Chronic disease like diabetes or high blood pressure accounts for 95% of the healthcare costs for elderly adults. The use of costs of drugs will continue to increase, driven by a large number of older adults with chronic illnesses. It is common for many seniors to take multiple medication. In a national study on medication use, 57 of women and 59 of men over 65 reported using 5 to 9 medications, including prescriptions, over-the-counter, or dietary and herbal medicine. Senior adults are at risk for medication misuse and abuse medication because they use more prescription and over-the-counter drugs than any other age group. Also, they're more likely to experience problems with small amounts of medication because of increased medication sensitivity, as well as a slower metabolism and elimination. Drug misuse is defined as taking prescription or over-the-counter medicine in any way that is not as directed. There are several ways of prescribed drugs can be misused, such as taking a higher dose, taking the drug longer, using for other purposes, using with other medicine or alcohol, or skipping doses or ordering a medicine, which is also a drug. Misuse can lead to harmful side effects and increase the risk of suffering a bad or negative drug reaction. Misuse of medication can occur purposely or accidentally. In either cases, the misuse of medication can be dangerous and can lead to poor health outcomes. This was the case for Betty's story. Misuse of prescribed pain medications such as opiates can lead to drug dependence or addiction. Abuse can result from taking medication not intended for the use. Medication is not a one-size-fits-all remedy. Taking prescription prescribed from someone else is a form of drug abuse. Commonly misused and abused drugs are opiates and stimulants, which are most often prescribed to treat attention deficit hyperactivity disorder. Older adults with chronic conditions such as diabetes, high blood pressure, or high cholesterol are typically taking several drugs a day. Medicine, or MedSmart, is a way to be safe. Making wise decisions when taking either prescription or over-the-counter drugs is a way to prevent misuse or abuse. There are 5 easy-to-remember habits to practice being MedSmart. To remember these tips, think of each letter in the word SMART. S means is to speak up with your healthcare provider. M is to maintain a medicine list, A is to avoid medicine mistakes, R is to read your labels, and T is to take medicines as directed and take responsibility. Putting into practice these MedSmart habits will keep you informed and in charge of your health. Each of these actions will be discussed in more details in the section of the top. Keep in mind that the medications are safe for everyone if they are taken as directed or prescribed specifically for you. The time is now to be MedSmart. It's up to you to take responsibility for the prescription or over-the-counter medicine you take. Let's review SMART once again. For example, speak up. It's the first way to be MedSmart. Is there an instruction you don't understand? Something that contradicts what you've heard before? If so, speak up. Take charge by getting answers from your doctor or healthcare provider. Advocate for your health and ask questions. Here are some questions to learn more about your medicine. What is the name of the medication? What is it supposed to do? How long are you supposed to take it? What foods, drinks, or medicine or activities should you avoid while taking this medicine? What are the possible side effects, and what do I do if this occurs? And is there any written information available about the medication? Because a different medication can cause different reactions, you need to talk to your healthcare team about possible negative effects of the drug. You will likely have other questions for your doctor. Keep a list of those questions to prepare for your doctor's visit. It is crucial that you fully understand the proper way to take your medicine, especially about possible side effects. Don't forget to inform your doctor of other drugs you're taking, including over-the-counter. Maintain a medicine list and keep it up to date. It is a second way to be MedSmart. Being informed about the drugs you're taking is a way you can take ownership of your health. This handout you're receiving is a medicine list developed for this talk. A medicine list should contain important facts about the medicine. This includes the name of the drug, what it's used for, the color, the shape, when to take it, how to take your medicine, for example, being or after meals or with food, and the doctor prescribing the drug. Avoid problems. Avoid medicine mistakes is the third MedSmart action. Safely take your medicine in a critical part of being MedSmart. What type of problems have you heard or that you were caused by the medicine? Some other problems you haven't heard about is an allergic reaction or a side effect, such as a headache or an upset stomach. Oftentimes problems happen when medicines are not taken as directed. Here are a few tips on how to avoid medicine mistakes. Organize your medication. Check the expiration date of your medication. It may not be safe or works after it expires. Do not take medicine in the dark. Read the medicine labels for the instructions and information about possible dangers. This includes how many times a day to take the drug and how much to take each time. Special instructions such as whether the drug needs to be taken with or without food. Warning about possible side effects and interaction with other drugs. A list of active ingredients. Keep your medicine in a bottle where it comes from. The amber color protects the medicine from the light. You will also have the information right there about medicine and how often to take it. The label will also have the phone number and pharmacy so you can call them when it's time to refill. Do not throw away the original bottle or box. The container tells your name and drugs and how to take it and possible side effects. So this is an over-the-counter drug fact label. It's found in the back of the over-the-counter packages or the package insert in a consumer medicine information, which is a CMI. I will review each drug facts. One is the active ingredient, which is a chemical compound that works in the body to bring relief. 2 is the use, tells you only symptoms the drug is intended to treat. Warnings tells medicine, foods, or situations to avoid when taking the drug. Directions, daily dosage and frequency of doses, and other information such as useful information such as how to store your medicine. Number 6, inactive ingredients, chemical compounds that have no effect on the body, such as preservatives. In addition to the above information, look for expiration dates on the label. If it says discard after expiration date, the drug may not be safe or effective after this time. Speak with your pharmacist about how to safely throw away your unused drugs. Labels will also provide information on how to safely store your medicine. Some common guidelines are: store drugs in a dry, cool place. Do not store them in the bathroom cabinet or near a stove or microwave. Do not refrigerate them unless labeled so. Take medicine as directed and take responsibly. Applies to adults regardless of age. Nearly half of adults do not take drugs as directed. If you think you are not taking your medicine properly, it's time to stop. Oftentimes, not fully understanding the medicine instruction can lead to misuse or possibly abuse. Part of taking your drug responsibly is to not share your medicines. Prescription drugs are personalized just for you. Your prescription dosage and schedules are right for you. Doctors and pharmacists customize medicine for their patients. That is why you should not make any changes on how you take the drugs. I would like you to consider taking the MedSmart Personal Pledge to maintain a medicine list. If not today, plan to adopt using a medicine list in the next 3 months. Today we discussed that seniors typically take multiple medicines a day and adverse drug events are a problem for the Medicare patient. With the number of U.S. seniors adults expected to grow by 2030, educating about medicine safely is crucial and concern. Feel free to share this information with your friends and family. The MedSmart Challenge is for everyone regardless of your age. In closing, there's no better time than today to be MedSmart. Thank you for listening. Now, how many steps did you take during this presentation? Please comment below.